So our residency program is really designed to help residents take who they are and become the very best physician that they can be. So to do that, we have a curriculum that is spread across the hospital and the outpatient sector, almost 50-50. And we do that to prepare residents to be hospitalists or to work in an outpatient sector. We care for vulnerable populations at our FQHC, and so through that work, residents really learn to use the broad spectrum of their talents to care for a community.
What really drew me towards FMRI is that I saw it as a program for me who really liked things in all different directions: OB, inpatient medicine, family medicine.
We are truly trying to sculpt family docs that kind of know how to do everything and can go wherever they want with their career. And so we have several months of inpatient work, especially during the intern year. And those usually happen in about 4-week chunks of time so that you can kind of dive in, learn how a system works, get your feet wet, and start getting comfortable in that area. And then you'll usually go visit that again later. So a month of OB here, and then a month later, a month of inpatient with the hospitalist, and then a month of that later in the year. A month with our family medicine service where you're kind of doing all of the things, and another month of that later. Along with a pretty robust outpatient experience where you're working with our faculty in the clinic, and you're working with our psychologists at the clinic itself to learn how to be a more efficient doc and meet the needs of your community.
I really liked this program here in Nampa. I speak Spanish, so I really wanted to be able to have the opportunity to use that. And then I was also really interested in obstetrics, and we do plenty of obstetrics here. And then I wanted to just do broad spectrum family medicine, so it's been really great to be at a place where we're the only residents in this hospital, so we really get to run the show on so many different levels, you know, whether it be on the OB floor or on the hospital floor or in clinic, lots of different places to get yourself involved and feel competent.
And we have a really wonderful opportunity to deliver many, many mothers. And I will say the need is high here, and that experience has definitely exceeded my expectations.
For me, it was also the program size. You know, it's a 6 per class program. So that's sort of it's a smaller size of program, but it's not like so tiny. So I thought that felt like a really nice fit for sort of me and sort of the kind of needs that I have as a learner.
One of the benefits of being in a small program is that we have a fair amount of flexibility with our curriculum. We have a lot of time set aside to work with subspecialists in the outpatient world. We have a number of elective opportunities, and I really am seeking residents who want to lean into becoming that master adaptive learner. How do I know what I need as an individual to become the best me, and being really reflective about that, and then able to let us know what will meet those needs to get people to grow.
A huge component that our residents learn is how to function as part of a team, because as anyone who has played team sports or worked on a team, you have to learn how to function together as a team. You have to learn what other people can bring to the table. You can't just put people together and expect them to be a high-functioning team. So our residents learn how to be part of a primary care integrated team model of care. In addition, our residents gain a ton of expertise in treating common mental health disorders such as like anxiety and depression. We have a pretty robust training program and medication to address substance use disorders, which is really important, and I think a place that primary care providers need to feel comfortable. Our residents also get quite a bit of training and motivational interviewing to support patients in making behavior change. And our residents will gain quite a bit of expertise in doing risk assessment, so managing patients who may come into primary care and have thoughts of suicide, and even maybe a plan and figuring out how to maintain safety in a collaborative way with a patient.
So our program is a federally qualified health center, and so that means that we take all comers regardless of their insurance status. So we see a large amount of Medicaid patients, Medicare patients. We also have a decent amount of, just because there are so few doctors, insured patients as well, so you do get to learn how to work with commercial insurance. And then a large portion of people who don't have insurance and qualify for our sliding fee, and so can get fabulous discounts to get medical care.
We are really fortunate to be in Idaho. Idaho is a very rural state, and so one of the really nice opportunities for our residents here is to go out into a rural community, a smaller space, and work one-on-one with physicians who have been practicing in that community. We have residents go out for 2 weeks in their first year, and then 4 weeks in their second year, 4 weeks in their third year, to various places throughout the state, and really have that immersive experience.
The family that we find here, and I use that word because I don't think I could get through a week, a day, a shift without my co-residents. I think the best parts of medical training are the people that you're surrounded by. None of this is a solo effort. It's all teamwork, and I think most, if not every single one of our residents really share that. That's part of like our identity as a program, is that we're doing this together, that no one is siloed. Even if you feel like I'm on this rotation by myself, they're always a text, a phone call, a Volt message away to be able to give you insight, help you find what to click in Epic, make sure that you're prepared and equipped to be the best you can be.
And so I love having the team in the precepting room, and I love using the team when we're doing inpatient medicine, because I can offload some of my work to people that are really good at what they do and have the skills and the knowledge to benefit my patients, and I feel confident that as part of that team we can do better care. So it's been really rewarding to learn how to be a good healthcare team member, because I feel like I'm doing a better job at what I do just by utilizing and being a part of this team.